Again, insomnia, if it is persistent and it interferes with, the point that for somebody who's in addiction, if their insomnia is so bad that they can't go to work, they can't stay awake at meetings, they can't participate in their recovery or do anything, they definitely need to see an addiction psychiatrist to look at some non-addictive medications that can help with sleep. When all these sleep medications like the Xanax and the Ativan and Valium were identified as a problem, wouldn't you know, the drug company would come out with a bunch of medications which they were called non-narcotic alternatives, non-addictive alternatives to those sedatives. And those are listed, those are the brand names listed there, the Ambien, Lunesta, and Sonata. And wouldn't you know it, just like the Ultram, a year or so later we found out they work exactly the same as the regular benzodiazepine sedatives and cause the same level of problems. Some people have reported to me using melatonin as a natural supplement can be very helpful with sleep. Okay, those in recovery, think back, the first couple of months, a little depressed? Just a little bit, yeah. Again, absolutely universal. All right, this is something that just is part of this huge change that occurred in somebody's life when they had either this awful moment of clarity and no skills to deal with life, can feel depressed and or feel sad and may confuse that with standard depression. Again, these things get better over time. I know people who were just about to be prescribed antidepressants and used recovery to try to treat their symptoms as a trial, and in most cases did extremely well. I know other people who came to recovery on 5 or 6 different antidepressant medications, had a lot of trouble being on those medications. They felt miserable and were able to, with their psychiatrist and with recovery, responsibly get off those medications. I am not recommending as a whole that people who are in recovery should stop their antidepressants. It's something to talk to your, hopefully, addiction psychiatrist or psychiatrist about to help you. And this just read that. That makes perfect sense. Because of the lack of training, anyone who's depressed walks into a psychiatrist's office, whether they have an addiction or not, ends up getting a lot of medications. And arguably, this is being overprescribed. So patients have their drug of choice. They come into recovery, they work their steps, they get sober, they have a sponsor, they're of service, they're part of the community, they're doing well, and this goes on for years. They're 20 years sober.